It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare. Presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. I was thinking last night when I was in bed that I was so happy we didn't decide to do this show at 7 in the morning, which was the original spot. Listen, I'm Sharon Gauthier. I'm from a private care coordination company, and we have this show, Revolution Healthcare, because I strongly believe that the healthcare system is in a revolution, which is change, and talking about the stories and educating people. I'm very happy today to have with me Dr. Manon Cox, who is from Protein Sciences, which is a company that's right in our backyard, and they developed a flu vaccine, which we are entering flu season, called Flublok, which our company has supported with 4 flu clinics that we are sponsoring. And with her is Susan, is it Manganello? Manganello. And Susan is the one in Protein Sciences that coordinates the flu clinics, and they also have a mobile flu clinic this year. So we're going to talk a little bit about the flu season, why people should get flu vaccines, a little bit about Flubloks. So welcome, Manon.
Good morning, Sharon. Thank you for having us.
Well, we're more than happy to have you here talking about this, and we'll certainly have you back as the flu season continues. And thank you also for help sponsoring us. So can you just talk a little bit about your background and also about the flu vaccine, because I know your expertise is vaccines.
Yes, so I've been with Protein Sciences for 17 years now, and as I joined the company had already done clinical studies to prove that Flublok was able to prevent the flu. It took actually about 14 years and many clinical studies in many subjects to gather sufficient data to convince the FDA that this was a vaccine that was safe and efficacious. And we were very proud that last year we were able to conduct a clinical study with a quadrivalent version of Flublok that showed that making the vaccine in a modern way, matching the virus that was out there circulating, actually resulted in a much better performance of this vaccine in comparison to a traditional egg-derived vaccine. My background is really, I am from the Netherlands, as you can hear from my accent. I came to the United States 17 years ago to work with this company because I really loved the technology that they had, because they have a modern technology to make vaccines that are based on pure proteins and that can help you protect you from all kind of diseases. And we selected the flu because the flu is a disease that is relatively well understood. We know what a protective antigen is. We know what kind of antibodies your body needs to make to protect yourself against the flu. But what I really hope and what my wish really is that beyond that we can make vaccines for all kind of diseases to protect people. So I'm a molecular biologist by background, a scientist by background, and it has really been very rewarding to be able to be involved in the development with obviously a big team of people in the development of this revolutionary vaccine. Some people call this revolutionary. I don't necessarily think it is, because we knew what a protective antigen was. That was already known for 50 years. And the technology to actually make a modern vaccine like Flublok has been around for 30 years. And it's kind of disappointing in my mind that most influenza vaccines and in general other vaccines, more than 90% of all vaccines are made with technology that was developed 70 years ago. And you just think in today's world, we don't drive cars anymore that were made 20 or 70 years ago. We have computers, everything has changed, but our medicines really, especially vaccines, haven't modernized as much as they should.
So can you compare then the difference between the vaccine that we're used to getting before Flublok came and then what the vaccine is that Flublok is, and also the reasons why people really need to be serious about taking the flu vaccine?
Yeah, so let me start with your first question first. The the vaccines, the influenza vaccines that have been out on the market for the last 70 years are based on growing an influenza virus in a chicken embryo. And what that means is, since this virus is a virus that normally is present in the lungs of humans, in order to make that grow in a chicken embryo, you really have to modify it. You have to change it so that it can grow to high concentrations in chicken eggs. And the egg-based process has a number of limitations. We all know where the eggs come from, so it's not a sterile production process. You need to break the sterility of the egg to infect it with a influenza virus. And that basically means that you need to use antibiotics, preservatives. You will have rotten eggs in the process, so there will be endotoxins. You need to inactivate the influenza virus after you have grown it to high concentration. So there's formaldehyde in these vaccines, and there's other proteins derived from eggs and from the influenza virus that are not really relevant for your immune response. So if you compare Flublok with the traditional vaccines that are out there, the major differences are that Flublok is a pure protein vaccine that does not contain influenza virus residuals, no egg proteins, no antibiotics, no preservatives, and no stuff that you really don't need to have in there. So a pure protein vaccine, which is also a match to the circulating virus, because we are not dependent on getting high growth in chicken embryos. And that, again, was responsible for that better performance in comparison to a traditional vaccine, because you now have a protein that resembles the outside of the natural influenza virus that is out there. Now, why should people get vaccinated? And I'm really a very strong proponent of getting healthy people vaccinated. There are so many people who say to me, I don't get the flu shot because I never had the flu.
Right. Or I got the flu shot and I got sick.
Exactly. So, two things there. It is the healthy individuals that carry and spread the flu. If I, during the flu season, put 100 people in a room and I take a nasal swab from those 100 people, I can assure you that from 20 of them, I will be able to collect the flu virus. They may not be sick, they may be subclinically ill, right, and not realizing that they have the flu, but meanwhile they are spreading the virus to other healthy adults who will then again spread it to their children, to older people, to people that are immune compromised because they're suffering from cancer, cardiac disease, asthma, you name it. And in principle, they are just walking around with this virus that is actually a killer for people. Every year, about 30,000 Americans will die as a result of the complications of influenza. So it is really important that we get vaccinated. I mean, I really, and people that say that they can get the flu from the flu shot, what they may have experienced is those endotoxins that I talked about earlier, residuals that might be present in the traditional influenza vaccine that might give you feverish-like symptoms. It is not really the flu. People that have had the flu know what it is like. You're going to be in bed for 5 days. You can't move your anything. You have a headache. It's just a very serious disease.
And the people at higher risk, I'm glad you brought up the healthy people should be taking it, because for someone like my husband who takes care of our grandkids, he gets the flu shot not because he's necessarily worried about getting the flu. He's worried about being the carrier for the kids that he cares for, and people who care for elderly people. So that's why hospital environments, convalescent homes, people who care for other people, it's really important for them to get that vaccination to keep them from giving it to someone else.
Exactly.
And how is it spread?
Well, it's really spread through little drops that are present when I talk, and when people would put a light on me, you would see all these little droplets flowing through the air, and each droplet will contain gazillions of viruses. And then you will breathe it in, right, either through your mouth or through your nose, and there's where the virus will infect you. So it's a very highly contagious virus that, especially in humid conditions, really thrives extremely well.
And in the wintertime, we tend to spend more time together than outside, than not being together and shaking hands. Last year, actually, Metro Hartford Alliance that you and I belong to, I had started with Brian, the marketing person, that we did fist bumps during the wintertime instead of shaking hands, because that's
not a bad idea.
Right, because that is a great way to be able to spread the virus. So washing your hands, you don't want to be obsessive compulsive about it, but washing your hands is really important.
And also covering your mouth when you're sneezing, etc. And indeed, having good hygiene is extremely important.
Right. So as I talk about supporting this, one of the reasons why I had an interest in it is that our population that our service tends to manage are elderly. Mm-hmm. What I found is that people were having to get a booster with the flu vaccine. What I liked about Flublok is that the people last year in our group, and I wish I had done kind of a mini study about it because it would have been interesting even though small, but kind of proved your point. The clients of ours that got the Flublok vaccine did not get a booster, and they did not get the flu. And the people that didn't get the Flublok vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to take these people out in the snow or try to create a process for them to get a second vaccine. Mm. That's what I liked about it, because now I can support that. And this year we're supporting 4 clinics. We're trying to sponsor them in any venue we can. We have an independent elderly community that we're doing it in. And I will tell everybody about those flu clinics later. So to me, it made sense in a lot of ways in that they didn't have to get the booster, and it also is made from purity rather than having additives. And everyone's worried about additives in their injections.
So I'm really glad that you point that out. And again, we did a controlled clinical study during that season, and we showed with a laboratory-confirmed test, PCR, which is highly sensitive, that Flublok was 31% more efficacious than any traditional vaccine in preventing the flu. And then if you took a more stringent laboratory test, cell culture confirmed influenza, that number even went up to close to 50%. So, while not a single vaccine will be 100% protective, the improved performance of Flublok has an enormous impact for healthcare.
Well, and especially people who are involved in communities. Yes. Nurses and staff that work in hospitals, that's a community. People who live in an elderly community, they're having dinner together, they're having events together. And it was really important to me, and I was glad that White Oaks was one of the communities that jumped on this to have us come in and say, come in and get your vaccine. We even expanded it out to, I put it on Facebook. I've advertised it because if anybody walks in and they have their insurance card, we've always been in a position with the clinics that we have had with you guys to always have the vaccine available. And so I appreciate that. I wanted to talk a little bit to Susan. Susan is a registered nurse. She's been working with protein sciences for a while. She's also a great advocate for patients and had her own personal story, which I'm going to bring her on at another time to talk about that. But Susan, can you talk about being with Protein Science last year and how it's changed this year? Because I see a huge uptake on where we're going with this and the partnerships that you have.
Yes, thank you. One of the problems that we had last year was, after, seeing the poor efficacy and people asking for boosters, Hunter's Ambulance went and partnered with us, and we took a bus and we went to people's homes who were homebound, and we also offered free clinics at the time. So we decided to take it a step further and develop some partnerships and relationships with other organizations so that we can offer in a mobile setting Flublok and make it easy access for people. So the great partnership with Hunter's Ambulance is that we can now take it on the road and go anywhere in the state and offer Flublok to those that are requesting clinics. And to date, we have about 3,500, participants. So it's been really exciting. It's growing really fast in leaps and bounds. So the partnership is with Hunter's Ambulance, who has wrapped the bus with Flublok and the different partnerships and affiliations. And they have taken a bus and gutted it inside and turned it into a mobile clinic. So it's really cool because we have, private stations, we have workstations. So there's plenty of room for people to hop on and get their vaccination. And being in the ambulance company, it's great because they have this whole mobile initiative to keep people healthy, and it's a great way to partner. We also have a partnership now with Health Mart independent pharmacies who have come on board so that we can help service Medicaid clients and those that are underserved. So, that component is really fabulous. And also, too, one of the great affiliations that we have is Hartford Healthcare at Home, who has joined alliance with us, and they have provided a lot of nursing. And so it's a great collaboration with the community to serve those that really are looking for access. And we've gotten...
Susan, is there a specific number that people can call if they want to set up such a clinic?
And I also wanted to give my number, which I haven't done, and Brad Davis is always telling me, my friend, you need to give that phone number all the time. So the number to call here with any questions regarding the flu vaccine or any other questions you have is 888-574-2730. 888-574-2730. You can also listen to us on AM 1360. Go to ConnecticutTalkRadio.com and you'll be able to pull us up there and also listen. Yeah, I think a contact number, if there's anybody out there, would be great, Susan.
Yep, the contact is me, Susan Manganello, and it's 860-916-0172. If you also go to our website, www.flublok.com, you'll see it on the site as well. But you can reach me, and I can help set up the clinics for you.
And I believe another collaboration you had was with Health at Work.
Yes.
So Velocity Urgent Care, correct?
Yes.
Now, Velocity Urgent Care happens to be one of my favorite walk-ins because it's down the street from the Atria assisted living that I have a couple of clients in, and my favorite thing to do is to not hospitalize people.
Right.
So whenever there's an issue that's picked up on quickly, that's where I bring them. And the doctor actually showed up yesterday for the first flu clinic we had to do that. So talk a little bit about their initiative and your involvement with them.
Yeah, so that's also a great partnership that we have with Protein Sciences and with the physicians from Velocity Urgent Care, and that's also growing in leaps and bounds. And they take Flublok to the workplace. So you see a lot of, businesses who, are offering clinics, and so the Health at Work goes and offers clinics. And that number is Marissa Gorlick, and you can go onto our website, and she's the flu coordinator, and she could help set that up.
And people can also call our office at 860-703-1575. We're more than happy to give anyone information. We're actually supporting 4 clinics this year along with Flublok. Our first one was yesterday at the buildings that I live in. I'm assuming it was successful. I didn't hear anything back that it wasn't. October 6th at Berkshire Hathaway, 172 West Main Street in Avon from 9:30 to 11:30. October 16th at White Oaks Independent Setting, 230 Deming Street in Manchester, 9:30 to 11:30. It's an elderly community, and Always Best Care, that is a non-medical home care agency that has multiple aides involved with managing clients. We're having it there from 12:30 to 2:30, I believe, 135 Center Street, Manchester, Connecticut. We're going to put these up on our website also, which is revolutionhealthcareradio.com.
So, Sharon, maybe in addition to what we talked about and clinics where people can go to get Flublok, it's also important to realize that you can go to Targets that have pharmacies. You can go to independent pharmacies. You can ask your healthcare professional, because everybody is in principle able to order Flublok.
Oh, they are? Okay.
And last year, a lot of people heard from their doctors that Flublok was in short supply. That is not the case. Doctors can go to our website, find 5 different distributors where they can just give a call, and the next day they can have Flublok in their office. So,
and you're right in Connecticut.
We're right in Connecticut.
I mean, that's what I'm so proud of, is that we have a company in Connecticut that we can support. And I just think that it is, a wonderful access to a vaccine that is new and not using products that you indicated might be an issue for people. And I'm hoping that the governor is getting his flu vaccine from Flublok this year?
We have already seen a lot of government or political support. Commissioner Catherine Smith received Flublok. We had Larry McHugh, the head of the Chamber Middlesex, who received Flublok. We had the controller of the state receive Flublok, and we're very hopeful that the governor will follow this great example.
So, Governor Malloy, this is an invitation to you to please get your Flublok vaccine. If you have any issues, you can certainly call us, and we'd be more than happy to come and inject you ourselves at any time that is convenient for you. And again, our number here is 888-574-2730. This is AM 1360. We're talking to Dr. Manon Cox and Susan
Manganello.
I know, I always want to say Manganello. Manganello.
That's fine.
That's good, too. From Protein Sciences, I want to thank the both of you for coming today. Not only do I have an admiration for you, but I feel that we have a friendship that has grown, and I now have a partnership with a pharmacy called Care for You Pharmacy. Susan Leonard and I have been friends for years, or Leopard, and we're actually going to meet this week because I had said to her, look, get your flu vaccine from them, and she knew about it but didn't have access. We introduced, and we're going to be meeting in a week. So
yeah, that's fantastic.
Yeah, it is really good. So thank you very much, guys.
Thank you. Keep up your good work, Sharon.
Oh, thank you, Dr. Manon. And Susan, you had something else to say?
Yeah, I just want to mention that for those that want to book a clinic through Health at Work, they can also contact me, and I put them in touch with Marissa Gorlick because we keep in close contact with her. And also the Berkshire Hathaway is 9:30 to 10:30, so I just want to make sure people are aware of that.
9:30 to 10:30.
Yes.
Okay, 9:30 to
10:30.
Okay, 9:30 to 10:30. Thank you. I'll change that on my slip. Thank you, ladies. I'm sure we'll be talking to each other soon.
All right.
Thank you.
Bye-bye.
So, we're going to talk about a couple of things today. I think the flu vaccine is a good discussion that we had. And again, if anybody wants to call here, I know there's a lot of debate about people getting flu vaccines and concerns about getting it. I think that, again, Flublok is probably a great choice. I'm going to change the subject a little bit today and tell you a little bit about my week. I had a very busy week this week, and I wanted to discuss some of the problems that I've had within the healthcare system as far as coordinating care. One of my clients went to a wound clinic, and he goes every single week, and he actually came from a convalescent home and was transitioning into an assisted living that I was helping him with, or we were helping him with. So when he went to the wound clinic, I had given them a call, and again, he goes there every week, and asked them if they could schedule with him to get his Hickman out, which is a implanted port that he had in his chest for antibiotics. When the nurse called me back, what she said was that he would have to call the outpatient department in order to schedule this. I then said to her, I'm not sure why he would have to do it since he's right in your hospital with you. Can you do that for him? And she said, no, we don't do that. And again, I said, well, it doesn't make any sense to me. He's right there with you. Can you schedule this for him? Try to at least schedule it around the time that he sees you every week so he doesn't have to make another visit. And she insisted that that's not what they do. So he left there with a list or contact info to make the appointment himself. So my problem with this is hospitals and clinics, like the wound clinic or any other clinic that anybody goes to that's in the hospital, should be coordinating care for people. And if they're not doing that, then I have a problem with them not doing that. And if you have staff within the hospital who are basically arguing with you that they can't make a phone call within their own hospital and schedule people to do to get done what they need to get done, then I'm not quite sure where coordination of care comes from. As hospitals are moving forward, there's a huge discussion and push that they will be coordinating care for people, and this is a pure example of how that didn't happen. So, in fact, what happened is that he came back, and then I went ahead and made an appointment for him for the Hickman removal the following week, which had to be on a different day because we couldn't coordinate it on that day, and so now he has to go out on a different day, and this is a gentleman who has amputation of his toes and a wound vac, and it's difficult for him to get around in order to get the Hickman out. He left from a convalescent home that could have also taken that port out. So again, coordination of care, I think, is the key for people staying out of the hospitals. Readmissions today is a huge discussion across the board that we're still rallying with. And how are we going to keep people from being readmitted to the hospital, which means for the hospital environment and also means for the physician groups and will soon mean for the ancillary groups around them, convalescent homes, VNAs, that they will end up being penalized, I believe, starting in 2016-17 by not being paid by the payer sources if they're not coordinating care for people well and they do end up in the hospital. Before I go forward, I want to give you our phone number again. It's 888-574-2730. Please call us in with your stories and your questions. We just had Dr. Manon Cox on from Protein Sciences talking about vaccinations and the importance for vaccinations and why people should be getting them. And I also wanted to talk a little bit about Home Helpers. Home Helpers is a non-medical home care agency that we actually had on last week, and they're also one of our supporters, and they provide us with non-medical home care aides, home health aides, CNAs, homemakers, and what they do for us is give that support to families who really need to keep their or want to keep their family member at home, but need help with the shopping and the cooking and activities of daily living. They have 3 particular franchises in Connecticut that we're working with, Wallingford area, Enfield area, and Farmington area. Their website is homehelpershomecare.com, and you can call today for a free consultation to 860-698-2244. The other thing I wanted to bring up today is I think we've kind of worn out talking about the flu, although I'm sure I'm going to get all over Facebook the reasons why people shouldn't be injected. I wanted to talk a little bit about safety in a hospital environment and safety scores. There's a website called Hospital Safety Score, and you'll be able to put in there the hospital that you attend along with the state that you're in, and it will give a safety score to that hospital. The score is really based on many different things. It's based on errors that are made. It's based on safety and quality measures, and it's based on what outcomes are for the hospitals. So outcomes for hospitals are related to how they manage disease states, mortality and morbidity, which is the number of people that may have died in that hospital, and any injuries and accidents. Many hospitals in the country have safety records that wouldn't be tolerated in any other industry, and the statistics are more than alarming. And again, I'm reading from Hospital Safety Score, which is a website that provides this information. As many as 440,000 people die every year from hospital errors, injuries, accidents, and infections. Every year, 1 out of every 25 patients develops an infection while in the hospital, an infection that didn't have to happen. So years ago, when I worked on a surgical floor, I can remember seeing groups of physicians, usually residents and the chief residents and group of residents, would go from room to room to room, and I used to tell my students this story when I taught, room to room to room, and I would see them never wash their hands. And it was on a surgical unit. They were using their stethoscopes to listen to, abdomens and chests, and they weren't washing their hands or anything else. Knowing that if I spoke to them directly, I would get into trouble, I then would train or educate my patients. Patients then, 15, 20 years ago stayed in the hospital for a much longer period of time, and, a week, 10 days than they do today. And I would say to each one of my patients, I would give them a booklet and a pencil, and I would say, look, when anyone comes in here, have them write down their name. because, as you know, they always come in groups. You don't know who you're talking to. It's a little overbearing. You're not feeling well. So have them write their name down and find out who the chief person, the person in charge in that group is. So that intimidated the physicians just a tad, but they did it. In addition to that, I would say to my patients, you need to ask everyone that comes in here if they wash their hands. And the patients looked at me and said, well, I assume that they did. And I would just reassure them and say, you know, everyone tries to wash their hands and keeps things going, but honestly, you have a right to ask them. So that's exactly what they did. So fast forward about 2 weeks later, I was called into the manager's office with the director, human resources there. That's never a good sign. The chief resident. And I was being told that I could not ask my patients or tell my patients that to ask the physicians if they wash their hands. And I asked them why. And the chief resident said to me, because you're insinuating that we don't. And I basically said, I'm really not insinuating anything. I'm telling them that they have a right to ask you if you wash your hands, because I see you go down the hall and you don't wash your hands. And like I said, this was probably 15, 20 years ago. And we know where that went. We know where that whole history of people not washing their hands brought us to the MRSAs and the infections that we have in hospitals. I will say that I had to stop doing it. I got written up. I thought I was going to get fired. But from that point forward on that surgical unit, I was the troublemaker. And I constantly would end up being reminded of things that I did or didn't do, and eventually got pushed out of the unit. But it's a good story of being kind of ahead of your game in recognizing what you feel is right, standing up for that. And to all my nursing friends out there, I would say that continues to be a problem in our system, in that if you, in fact, do bring forward an issue, you suddenly become the problem yourself. And that was an example of how, and the start of the problems that we have with infections in our hospital environments, that eventually they started to now have a big push for washing hands. And I would laugh when I would go with my clinical group in the hospitals now, because what do you see are signs everywhere. Wash your hands. Ask us if we wash our hands. But back then it was not the thing to do. So you're listening to Revolution Healthcare Radio. This is Sharon Gauthier, your host. We had with us Dr. Manon from Protein Sciences today, talking to us about the flu vaccine. Give us a call if you have any questions, concerns, if you have any stories of your own to tell, if you have any issues about taking the flu vaccine. Our number is 888-574-2730. You can hear us on 1360 AM radio. You can also go to ConnecticutTalkRadio.com, pull us up there to listen to us. So as we talk about errors and injuries and accidents and infections, errors have improved, I think. These statistics are from 2012. I think since then there has been an improvement in errors, but honestly there should be no errors, and there should be safety nets with people and systems so that errors don't ever happen. I wanted to share with you another story that talks about a medical error that happened this summer with one of my clients. So an 88-year-old lady was living independently in her home in an elderly community, and the family lived out of state, both the daughters. What they initiated was having a home health aide that came in to visit with her 3 times a week. She was able to get her meals there. She was a little forgetful, but basically walking, talking, and independent. And suddenly she was found, of course, on a time that the aide wasn't around, and went to the hospital because she had fallen. When she went to the hospital and they contacted the daughters, they immediately came up from their states, and she ended up spending 48 hours in the ER, which meant that she was in observation and not admitted. And they didn't find anything wrong with her other than they thought maybe she had had a seizure. She had a seizure disorder from years ago, was on medication for it, which usually happens if you have a seizure. They'll put you on meds forever and never take you off. but there was no clear indication that she had had a seizure. In the 48 hours that she spent in the ER, they never got her out of bed. And at 88 years old, when you don't get someone out of bed, that's a huge problem. So she gets transferred to a convalescent home that now the family needs to pay privately for, which is anywhere between $350 a day to $450 a day. So they were concerned because while they were there, their mom just wasn't getting any better. She was terribly confused. Physical therapy is trying to get her up, and they said every time they did, her blood pressure would drop dramatically. So 3 weeks went by before they contacted me. When they contacted me, I went in that evening to speak with them and provide the convalescent home with my HIPAA release form that we do. And I started looking through her chart at her medications. Now, you would think that there would be reconciliation of medications immediately, not just with transitioning someone from the hospital to the home, but also with families. And this family was extremely organized, had a list of her medications, but nobody talked to the family about that. So as I'm looking through her chart, I recognize that there's a medication that seems to be a high dose. So I started reviewing the meds with the daughter. Would have made sense to do that, right? So as I started reviewing it with the daughter, what happened was the daughter said that one of her blood pressure medications was actually tripled the dose. So she didn't know why they had tripled the dose. Now, anybody who knows anything about blood pressure medicine, it will cause you to have your blood pressure drop if you're taking too much, right? So I had already spoken to physical therapy department who was quite concerned about the drop in her blood pressure, but nothing was done about it in terms of discussions amongst the people within the convalescent home. Their comment to me was, well, nursing is taking care of it. So when this was picked up on, I immediately got the supervisor who came in, and the daughter said, my mother doesn't take this dose. This is 3 times of what she would normally take, which of course was the problem that created the issue with this woman not being able to move, and not being able to get up and being totally confused because they also increased her anti-seizure medications by triple. So I was told that night that it would be fixed. Went in the next day to talk to the family and physical therapy, and what had happened was it wasn't fixed. They did not get a hold of the doctor in a timely fashion. She got her morning dose. When I went in to visit her, the physical therapist said we can't get her up because her blood pressure is dropping. So then I went back to everyone again, and it eventually got fixed. When it got fixed, within 3 days, she was up in a chair. She was able to walk with a walker, and she progressed to have physical therapy and went back to her home. So that is an error in today's world. It is 2015. This just happened this summer. And so I would say to everyone who is out there, please be prepared with a list of your medications. Make sure that someone, if it's not yourself or someone in the family, is able to review that. And please encourage whatever place they go to look at those medications with them, because this could have been prevented for this woman who, if I had not, or we had not gotten involved, or if someone had not gotten involved in picking up on that era, this woman probably would not be around at all. So that is an example of medication errors that still happen in our system and shouldn't happen in our system. When they talk about injuries, accidents, infections, errors, let me talk a little bit about injuries and accidents. Many years ago, there was a huge push by hospital environments and entities that take care of people to have a no-lift policy. What the no-lift policy means, basically, is that people aren't going to be lifted by a human being. But to me, what that has created is a huge problem in the system, that people basically stay in bed and don't move at all. Or they use mechanisms and things like Hoyer lifts and Sarah lifts in order to move them, rather than allow the person to put any weight at all on their own feet. That issue of movement is the number one problem we have across the board with every entity we walk into. I'm actually going to have one of the daughters of one of my clients coming in, Tammy, to talk a little bit about what that created for her mom, who is now in a convalescent home, and we have been working on this together probably since June, and her mother is not home yet, all because walking was not encouraged and getting out of bed was not encouraged, and that creates a huge problem for everyone. So, again, anyone out there, if you'd like to give us a call, our number is 888-574-2730. I know you guys have stories of your own, questions of your own. Please give us a call. We'll be happy to talk to you and listen to your story. We would just ask that you leave the name of the entity you're involved with or physician out of it, because as I said at the beginning of this show, on September 12th, that it's really not about the individual place. It's about the story itself that can happen anywhere. So every year, 1 out of every 25 patients develops an infection. So infections, we already know, are rampant in the hospital. Washing your hands created a huge problem that now has been addressed. But I also think that because of the use of antibiotics in our industry, that has caused a lot of antibiotic-resistant infections for people who have that ability to be resistant in them, and it's usually kicked in when you're immune suppressed, and most people are when they go into the hospital. So it's a bed of infection that when you are already at risk, you're going to be at risk for more when you develop an infection in the hospital. Injury, people falling, again, is a problem. Trying to get therapy there quick enough, trying to get nurses to get orders to get people out of bed. Injuries from falls are another issue that hospitals and entities work with all the time and are concerned about. Infections, errors, accidents, I think, are under injuries. What this hospital safety score website also talks about is what should you do if you see an error made in the hospital. So that is something that we are aware of often. I always say to people, when we first entered hospitals, they were very concerned that as nurses we were going to look at things differently, and of course we do. And what we do is that we just make them aware of it. If someone comes in with one dosage and a dosage has been changed for no apparent reason, and it might be an error, we just let them know. And basically that's what you need to realize, is that you have a right to say something if you feel that there's a problem. So you need to talk to someone immediately. If you can talk to someone within the system, that is the nurse, the supervisor on the unit, there's always in-house supervisor. You need to talk to someone immediately if there is an error that you see that was made with your loved one. As nurses, if you see an error that was made and it puts you in a tenuous situation, I know you need to talk about it immediately. You don't want to wait to report the incident. If no one you know is around, all healthcare staff, from physicians to custodial crew, are there to make your care as safe as possible. You need to discuss the issue respectfully, yet in an assertive manner. And sometimes when you're upset about something, it's very difficult to be respectful and assertive because it's your loved one that you're talking about. You also need to receive an answer during your stay as to how that error was addressed. I will say that I think most hospitals and entities are very good about addressing when an error happens, sharing it with the families, and immediately making a change. That is the right thing to do. There's many systems that have been developed through the years in reporting errors. There are processes in the hospital. The state has a mandate for particular errors and infections that the hospitals are mandated, meaning they have to report to the state, so the state can certainly monitor that so it's not to happen again. What is the difference between patient safety and quality? Well, patient safety, an important element, is an effective, efficient healthcare system where quality prevails. Here's how you can break it down a little. Safety has to do with the lack of harm. So when you enter any place and you're ill or your loved one is ill, you want to feel safe. And how does that happen? Well, I think that having a friendly person who feels or appears to be knowledgeable about who you are and what's going on with you certainly creates a feeling of safety. So when one of our patients got transferred literally across the hall from an observation unit to being admitted, I found it very disturbing that the 3 nurses that she had in 2 different days did not know the whole story about her. And I immediately didn't feel confident in that unit that they knew how to manage this person with dementia who had come from a unit, who was in there from a fall, who needed to go to a convalescent home, who knew about the family. Every person I spoke to seemed to be missing a piece. And this is what happens when there is no continuity and you have multiple people involved with that one person. So safety, lack of harm. You want to feel safe when you're in there, and it first starts with communication. So if you're sitting there in your bed and a doctor comes in and asks you about your history and your medications and how you got there and has a discussion, you feel like you've already given that to someone who needed to know. But unfortunately what happens is then you have someone else who shows up 5 minutes later, and I know all of you out there have experienced this, who are asking the same questions. And you kind of look at them thinking, why am I repeating all of this? I just told someone exactly what you're asking. And I actually have had some little old ladies who've been, because your filter kind of loosens up as you get older, which I always told my children to be aware of with me. But I've had a very elderly woman who basically lambasted one of the physicians and saying, I just went through this, I'm not doing it again. All of those discussions create a feeling of being safe in whatever situation you're in. Again, our number is 1-888-574-2730. We're talking about the difference between patient safety and patient quality. Quality has to do with efficient, effective, purposeful care that gets the job done at the right time. So quality in those environments, to me, would mean to a patient and to me in that the nurse knows when to deliver medications on time. They know what medications you're allergic to. They know what medications they're giving you, and they're able to explain that to you. They're also there when you need them. So quality kind of goes hand in hand with safety, that if people don't feel safe and comfortable and trust that there will be no harm, quality is not going to matter a lot. Because as I used to say to my staff in the ER, the reports and letters that we got had little to do with quality. I knew that those nurses could go into a trauma unit and be able to manage that trauma quite well. It really went back to safety and confidence in the staff across the board, because if that same person came out and sat in a room or in the hallway for 20 hours or 10 hours, was never asked if they needed a blanket, a drink of water, something to eat, then the whole process of that patient and family feeling confident in the care that you can provide to them has been damaged. So quality has to do with efficiency, and I do have to say that most hospital environments and convalescent homes are pretty efficient. They have systems in place that they know when to deliver your medications. They know how to deliver the medications. But do they know what the medications are? I'm not really sure that discussion goes on very well with the staff. And I do have patients who are quite capable of saying, why am I getting this? And remember, when you go from your community with a blue pill and you enter the hospital, you may not get that blue pill, but you know that you take that blue pill every day. You've now gone to the hospital who now has their own system and medications that they use. The blue pill that you're now taking may now be the yellow pill. The yellow pill's in the same family, so you're still taking the same kind of medicine, but you don't know that. And when the nurse shows up at your bedside with now a yellow pill, you do have a right to say, why is this a yellow pill? And they don't have a right to say, just take it. You know, you need to take it because the doctor ordered it. So there's a lot of confusion that's created by our very efficient systems that people are basically thought of to fall into and agree to without questioning it. And I'm saying for the quality and the safety of yourself, you need to question what goes on. So quality and safety are two different things. Safety, lack of harm. Quality, efficient, effective, purposeful care. Safety focuses on avoiding bad events, right? we want to make sure you don't fall out of bed. We want to make sure that you get out of bed and you're able to walk safely. We want to make sure that you have slippers on that aren't going to slide on the floor, that you have a gown on that is going to allow you to have some dignity, that safety for you is going to be having an alarm that you can press when you need someone and you need help, that person comes as quick as possible so that you're not going to take it upon yourself to get out of bed or do whatever it is you need to do because someone's not showing up. That's what our system people should be providing all of us when we go in as a patient anywhere. Quality raises the ceiling so the overall care experience is a better one. Well, many of you out there, I'm sure, have had very poor experiences. Many of you out there have had great experiences. We hear more about the poor experiences than we do the great experiences. I have a peer of mine who is a professor at a college that I'm going to bring on to talk about her experience with her husband with an unexpected hospitalization. And it really all goes back to safety, quality, communication. Everyone needs to be able to communicate with each other, and that's still not happening, even though we have the tools available to us to make that communication better. You will be able to observe and interpret activities and conversations differently from your healthcare team. So what I always hear is that one doctor comes in and tells me one story, another doctor comes in and tells me another story. When that happens, I absolutely think that you have a right to ask the question, and people are very intimidated by that. And I'm saying to you, don't be intimidated by that. They will be happy for the most part that you are asking that question, because at the end of the day, it's about you. It's about how you go home. It's about the information that you have, and it's about the safety and quality of care that you receive that needs to be improved upon, but that improvement doesn't happen unless we're all part of the process, which means you as the patient and the family need to speak up and not worry about whether or not someone might get upset with you. You're listening to Revolution Healthcare Radio. This is Sharon Gauthier, your host. I'm a registered nurse. I'm talking about the revolution in healthcare right now, the issues involved with care coordination, medication reconciliation, and what quality means, in hospitalization, and what you can expect when you are hospitalized and what actually happens to you. We also were very fortunate this morning to hear about the flu vaccine. If you have any questions, please give us a call at 1-888-574-2730. Ask us anything you'd like. Please share your stories with us. We would love to hear from you. It's a new show. There's nothing like this show out there where people can actually talk about the stories and talk about the experiences, and we can share with you how you might be able to manage and navigate the healthcare system, your life just a little bit better as you age and if you have difficulties with chronic diseases. I wanted to talk a little bit today about the populations at home because we have a huge baby boom, which I'm one of them, the baby boomers that are growing into our population right now, and we're all going to have a lot of needs. Everybody wants to stay at home. I want to stay at home. You want to stay at home. And oftentimes families are told by their parents, I don't want to leave here. Please don't put me in a convalescent home. I don't want to go anywhere. But they don't know where to turn when they need help. So because that population has expanded dramatically in the last 5 years and will expand threefold in the next 20 years, there are a lot of resources out there for people that they can access. And what those resources are is what you need to learn about. So I talk about home care, and home care and home health care are two different things. I know we talked a little bit about that last week. So home care agencies that are basically an unregulated group of agencies that have opened up, and it's been a huge business not only across the state of Connecticut, but across the country, because people do recognize that there's a huge need, is the homemakers and companions and the CNAs that you need at home to help your mom or dad. I would caution all of you when you start Googling this that you will be hit with a myriad of choices out there, and you don't know quite how to evaluate the difference between getting help from a home care agency and getting help from a home health care agency. So I'm going to talk more about that because we didn't really hit on that enough last week. A home health care agency are your visiting nurses, and you will normally, when you leave the hospital, be referred to a visiting nurse organization that will then meet you at home, registered nurse, LPNs. They'll coordinate your care for you at home with physical therapy, occupational therapy, social work, speech therapy. That's all paid for under Medicare, but it's a short-term solution. They're not normally with that person at home for more than maybe 4 to 6 weeks, and then they're gone, and you're left with, well, what do I do now because my mom still needs to have help with a shower, my dad still needs help because he doesn't drive. That's where your home care agencies come into play. Now, home care agencies are not licensed in this state. They are registered. They are registered with the State Department of Consumer Protection, and if you go on the State Department of Consumer Protection site, you'll be able to pull the regulations for homemakers and companions. They all have a registration. Nobody is different than anybody else who provides care with homemakers, companions, and CNAs. But they're all not providing the same care, and that is concerning to me and should be concerning to everyone else. So you'll Google this, and what you will find is agencies that almost appear to be medical agencies, like a VNA. They'll say they have nurses, they use medical terms like hospice, Parkinson's, end-stage diseases, CHF. None of those things are pertinent with a non-medical home care agency, except that those particular disease states are ones that those people need help with activities of daily living. Those terms have nothing really to do with other than informing you that if your loved one has Parkinson's and they need help with bathing, shopping, cooking, cleaning, that agency will provide that. Nothing more than that. They're not going to manage the person with Parkinson's disease other than helping them manage their own needs during the day. So be cautious of the agencies that are saying that they have nurses involved with them, because there should be no nurses involved with them. Nurses are required by law to function as a nurse. And if they're working with a non-medical home care agency, they cannot function as a nurse. They cannot put your medications together. They cannot assess you. They cannot put together a clinical care plan. That's not what a non-medical agency is about. That is what a home health care agency is about, not a home care agency. So again, my caution goes out to all of you regarding this. We are coming to the close of our show today. Thank you so much for joining us today. Please join us every week on Revolution Healthcare Radio, Connecticut, the Talk of Connecticut. Again, you can reach our website, revolutionhealthcareradio.com. Have a great week and a happy, healthy week to all.